Unexpected news stories of this decade. One of the unexpected things that has happened all over the country, particularly in the last 5 years, is that there has been a huge and rapid escalation in heroin use in our country. And also in the number of deaths in all age groups, in all stratas of society, in all states, from heroin overdoses. And because the heroin epidemic has been so big, and because it has not been geographically concentrated in any one place, it's been all over, right, in the cities, in suburbs, in rural areas, everywhere, blue states, red states, everywhere. It has led to some surprising alliances in terms of people coming together to try to find a solution to this problem. It has led to some surprising policy outcomes. For example, in Indiana, the IV drug use problem was so pervasive in some Indiana communities that the state not only had this huge drug problem on its hands with all the things that go along with that, it also specifically had a huge increase in the kinds of serious diseases that can be spread through people sharing needles. Including HIV, the virus that causes AIDS. And so in Indiana, of all places, with their very conservative legislature and their very, very, very conservative governor, Indiana ended up having to institute a needle exchange program that was both sanctioned by the state and funded by the state, just because their public health crisis around heroin use got so bad. In the state of Maine, Maine is a state that looks big on the map, but it has a very small population. There's only about 1.3 million people in the whole state. The state of Maine has had just an incredible problem of people dying from drug overdoses. Last year, I mean, Maine only has a population that's slightly bigger than the population of Rhode Island. 1.3 million people in the whole state. Maine had 272 people die of drug overdoses last year. That means just in the state of Maine, a person died from a drug overdose every 32 hours in that state all last year. And that was a 31% increase over the number of people dying from drug overdoses the previous year. So it's a terrible problem and getting much worse very fast. Now, one life-saving development, though, alongside this huge spike in heroin use and heroin overdoses, has been the increasing availability of a drug called Narcan. Narcan is essentially a last resort way to save somebody's life if they're overdosing, to keep them alive until paramedics can get there if a person is overdosing on opiates. It's not an expensive drug, it's not that hard to administer, but it can really be the difference between life and death. It's basically an emergency antidote. And it has frequently been used to save lives. Let's look at the example of Maine, and let's just take one city in Maine. Let's take Portland, Maine, and the Portland, Maine Fire Department. Just that one first responding agency in that one city in that one state. In 2014, the Portland, Maine Fire Department administered Narcan as an emergency heroin antidote to reverse an overdose 107 times in 2014. So like every 3 days or so, they're saving somebody's life with this drug. That was 2014. We don't have the final numbers on how many times they used it last year, but we know they were using it at a faster pace last year than they were the year before that. As heroin use and heroin overdoses have skyrocketed, this little cheap drug, Narcan, has brought back hundreds of people who would probably have otherwise died, not just in that one state, but in that one city. And so last year, Angus King, he's now the independent senator from the state of Maine, but he had previously been governor of Maine. Last year, Angus King wrote to the biggest drugstore chain in the state. He wrote to CVS, and he asked CVS to please take steps to make this life-saving drug more easily available to people who might need to have access to it in Maine. And CVS said they were willing to do that, but in order to do it, there would have to be a change in state law so they could let pharmacists at CVS stores dispense it more easily without a prescription. Right? The idea is very simple. If you've got a drug user in your life, if there are people in your circle or people in your community who are at risk for ODing, that is a terrible thing. If you can have a dose of Narcan on you or in the glove box of your car or somewhere accessible in your house, in the awful event that something like that happens, you might have one last chance to keep them alive. There might be one last chance to keep them alive for a few minutes until the ambulance gets there and they can save them. So Angus King asked this drugstore chain to start doing that. The drugstore chain said, we would love to do that, but there does need to be a change in state law. And so the drugstore chain requested that the state legislature take this up. And the Maine state legislature, for all its partisanship, all of its dysfunction, just like any other legislature in the country, they came together around this. And the legislature passed a bill that would make Narcan much more easily available in the state of Maine, simply so more lives could be saved. All of the medical associations in the state came out in favor of it. All the law enforcement organizations in the state came out in favor of it. This was not a partisan thing. Democrats voted for it. Republicans voted for it. Full speed ahead. And Maine's governor vetoed it. Now, that is a little bit of an unexpected thing if you take a broad view of it. I mean, something like 30 other states have done this, what Maine just tried to do. Something like 30 other states have taken steps to expand access to Narcan. It's not like Maine was going out on a limb here and trying something nobody had ever done, or they didn't know what the effects of it would be. Lots of other states have done this. Most other states in the country have done this. And Maine's problem with heroin is as bad or worse than any of their other states that have done this. But Maine's governor stepped in after everybody else in the state basically came to consensus on this. At one point, one part of passing this to the legislature passed unanimously, part of it. I mean, and everybody agrees that this is a thing that can provably change lives. And the governor steps in and says, nope, I won't allow it. It's kind of amazing, right? I mean, Maine, once again, is paying the price for having this particular governor. Who also makes decisions and says stuff and does stuff that sometimes make it even just hard to cover him as a news story.
We're about to put on screen what the governor said in response, and some of our viewers who may find it distasteful may want to hit the mute button and turn away for the next 20 seconds or so. The governor told the reporters, Senator Jackson claims to be for the people, but he's the first one to give it to the people without providing Vaseline. When he was asked if he realized some people may find that comment offensive, he's reported to have said, good, it ought to, because I've been taking it for 2 years.
The only thing that I've heard is if you take a plastic bottle, put it in a microwave, and then heat it up, it gives off a chemical that's similar to estrogen. And so, I mean, in the worst cases, some women might have little beards.
The traffickers, these are people that take drugs. These are guys of the name D-Money, Smoothie, Shifty, these type of guys that come from Connecticut, New York. They come up here, they sell their heroin, then they go back home. Incidentally, half the time they impregnate a young white girl before they leave.
I'm not going to apologize to the Maine women for that, because if you go to Maine, you will see that we're essentially 95% white. If you want to make it racist, go right ahead, do whatever you want.
Maine's Republican governor, his name is Paul LePage, is so overtly and unapologetically obnoxious and specifically racist, and so frequently ridiculous that I think most of the rest of the country, if they know anything about him at all, they think of him as funny, right? He's essentially a joke, and he's made Maine politics into a nationwide joke. Or at least he's made himself into the punchline of a joke about public service these days, or the Republican Party these days, or how about that list of people who endorsed Chris Christie this year? I mean, right? Paul LePage is sometimes funny in a laughing at him, not laughing with him kind of way. But what he just did here, this is different. Because this is the veto message that Paul LePage signed and published and sent to us today when we asked for it, explaining why he was vetoing this bill on the heroin thing. This bill that would expand access to the overdose reversal drug, this drug that has saved hundreds of lives in his state alone, this drug that has no purpose other than to keep people who are otherwise dying alive for a few extra minutes so first responders can get to them and they will not die. This is his veto message saying he doesn't want that to be more available. I saw the veto message quoted in the Maine newspapers, and even though those are great papers, I sort of couldn't believe it until I saw it myself. So we got the veto message from the governor's office directly today, and it's true. This is it. Here is his explanation for why he vetoed the bill. Naloxone, which is the generic name for Narcan, naloxone does not truly save lives. It merely extends them until the next overdose. Just think about that for a second. He's saying, if you overdose, you should not be kept alive if there's an option to keep you alive. Because you are probably just going to overdose again. Why bother? Look at that. Narcan does not save lives. It merely extends them. And you know what? If you think about it further, I guess we all are going to die someday. So you can really say that about any medical treatment. I mean, why treat your infection with penicillin or antibiotics? All that's going to do is extend your life until it ends anyway someday. You have a treatable form of cancer? Why should the state of Maine abide you getting any treatment for it? Why extend your life when your life's just going to end anyway? Oh, you've been in a car accident? Well, frankly, it's a pain in the butt to patch you back together, make sure you don't bleed to death. That would just be extending your life, which is, after all, a finite thing. Why bother extending your life? Why not just let it end now? And of course, Paul LePage is not making those kinds of arguments for anybody else. He's only making this why extend your life argument for people whose lives are at risk because of drug overdoses. Because once you're overdosing, we have the option to save your life. The governor of that state says, we as a society would be better off not saving your life. Maine, the state of Maine would prefer that you were dead. We'll have the option to keep you alive. We'll choose not to exercise it. Maine's governor would prefer you dead. The veto message says he's vetoing access to this overdose antidote because it serves, quote, only to perpetuate the circle of addiction. By which he means it serves only to perpetuate the lives of people who are addicted. And he would prefer that they die. That would be better for Maine. It is, I mean, I feel like I have a thick skin when it comes to absorbing information about Paul LePage. I feel like I have a thick skin about politicians in general, but this slays me. It is almost impossible to believe that a politician is making this argument, and not just in an off-the-cuff, stupid, maybe half-drunken kind of remark that they regret later. This is his written statement, why he would prefer that some of his constituents should die rather than have their lives easily saved by a drug that costs about $5. But he's really just done this.
People are using heroin, they are dying every day, and this drug can actually prevent those deaths. It is our responsibility to make sure that it's in the hands of people who can use it to save people's lives.
Gideon's bill would let far more people have access to Narcan, to keep it handy in case a friend or loved one ODs.
There's 30 states that already allow pharmacists to do this. This idea that, we're reinventing the wheel here is not true.
But Governor LePage vetoed the bill, stating in part, naloxone doesn't truly save lives, it merely extends them until the next overdose. Pharmacist Joe Bruno says naloxone does save lives, but that it's no cure.
This drug, when you administer it, is good for about 30 minutes. Just enough time to call 911 and get this person to the hospital. This isn't, here's a dose of Narcan and you'll wake up and everything's fine. That's not how it works.
Gideon agrees, but says the governor's objection is wrong, citing a local woman who wanted the antidote for her own son.
If naloxone could save his life 10 times over, if it took 10 times to get him clean, then it would be worth it.
Paul LePage is an amazing thing in the state of Maine.